Concerned faculty in the Triad's largest school district are tackling one tough topic: teen drug use.
In the last 10 years, Guilford County Schools reported a, get this, 200% increase in overdose deaths.
And it doesn't stop there. New research shows the kids are concerned too. A recent survey at Northern Guilford High School found 88% of students believe drug use, either on or off campus, is a really severe issue. And 22% of them consider drug use a major problem at Northern Guilford.
Well, the president of the PTSA says the main concerns at Northern Guilford are alcoholism and vaping. However, fentanyl is not out of the question. She's worried it's only a matter of time before a student gets their hands on the deadly substance and experiences an overdose. So the Northern Guilford High School PTSA is hosting a fentanyl town hall next week. Guilford County Board of Education is encouraging people from all schools to attend. Parents and staff will have the opportunity to learn about the drug and its dangers.
Only a small amount is enough to kill, but also fentanyl is very hard to detect. It can't be smelled, tasted, or even really seen.
Fentanyl is a powerful synthetic opioid. It's similar to morphine, but about 50 to 100 times more potent. Like morphine, it is a medicine used to treat patients with severe pain, especially after surgery. It is safe when being monitored in a medical setting. However, when used recreationally, the drug can get dangerous. Drug dealers are mixing fentanyl with other substances like heroin, cocaine, Molly, and meth, and using fentanyl to make counterfeit prescription pills like Adderall.
That's the point I think we need to stress, especially to parents, is no matter where you live in an open-air drug market. How can I say that? Because we all have smartphones and we all have access to social media where these dangerous drugs are now sold.
Fentanyl is the #1 killer of young adults across the nation. You really get a sense of the problem from the tragic display called Faces of Fentanyl at the Drug Enforcement Administration building. This is up in Virginia. It shows walls and walls of portraits representing the hundreds of victims killed by a drug overdose. The exhibit is made up of more than 2,000 faces, with 15 new victims added each day.
That's the point I think we need to stress, especially to parents, is no matter where you live in an open-air drug market. How can I say that? Because we all have smartphones and we all have access to social media where these dangerous drugs are now sold.
The DEA says it's easy for kids to get their hands on drugs. They don't even need a hookup at school anymore. A lot of the times, all they have to do is turn to social media, where strangers from across the country will sell them drugs. Snapchat is known for its fun filters and messages that disappear as soon as they're read. But one lawsuit says it is a much darker place than that. Matthew Bergman with the Social Media Victims Law Center says his firm is representing the families of 52 children who've died from fentanyl overdoses. He says all of them got the drug via Snapchat.
That's not an accident. That's because Snapchat is explicitly designed to evade oversight and parental responsibility.
Oh yeah, there we go.
Last year, overdose survivor Tyler showed us it took less than 30 seconds to find someone selling drugs on Snapchat.
It was pretty much Amazon for drugs.
A spokesperson for Snapchat wrote, "Dig into it. We use cutting-edge technology to help us proactively find and shut down drug dealers' accounts. We block search results for drug-related terms, redirecting Snapchatters to resources from experts about the dangers of fentanyl. We continually expand our support for law enforcement investigations, helping them bring dealers to justice. And we work closely with experts to share patterns of dealers' activities across platforms to more quickly identify and stop illegal behavior. We will continue to do everything we can to tackle this epidemic, including by working with other tech companies, public health agencies, law enforcement, families, and nonprofits." The Justice Department says you really do need to go through your kid's phone. Keep an eye out for these common emojis that are being used by kids to order those drugs on social media. But this isn't even half of the list. There are tons of drugs out there. We've got a slideshow up right now on our website, diving deeper into some of the commonly used emojis. Most of the time, Kids will do these with a pill in them, but not always. So it's a good rule of thumb. If you see a long string of emojis, do a quick Google search and then talk with your kids about it. Ask them what it means.
So where do these illegal drugs come from? The answer usually takes you out of the United States. The U.S. Attorney's Office says tunnels like this one right here were used to transport more than 17,000 pounds of cocaine. The illegal substances are also being smuggled in above ground. Dealers often get kind of crafty, like these packs of fentanyl found across the border with Mexico, hidden inside coconuts of all things. And if they can't get it underground, they'll sometimes transport it via air. Investigators found candy boxes stuffed with fentanyl in packages from China and India that made it through American airports.
Even if you think there's no chance your kids are doing drugs, health experts say it is still a good idea for parents to get one of these, a free dose of Narcan. It can help reverse an overdose. You never know, maybe one of your kids' friends will need it one day. It's really simple to use, and it may help save someone's life.
And insert it in her nostril, and then I would need to go ahead and push it.
Oh, okay.
That's it.
Well, doses of Narcan are free at the Guilford County Health Department or in a vending machine in the Forsyth County Detention Center lobby. So far, it's dispensed more than 700 free kits.
The CDC is also ramping up its attack on fentanyl. It's encouraging anyone who buys drugs to get fentanyl test strips. They cost less than $10 on Amazon. They're delivered through the mail, and no one has to know about it. The bottom line is that fentanyl is deadly. It's a nationwide problem, but it's also hitting the triad hard.
Yeah, if you or someone you know is struggling with addiction, there are a lot of resources out there. The Substance Abuse and Mental Health Services Administration has a 24/7 helpline.
On the confidential call, someone will help you learn more about treatment options and help you navigate when you're feeling triggered. Stay safe and think about others.